Hi, everybody. My name is Tina Bhutani. I'm a board-certified dermatologist and clinical researcher practicing in San Francisco, California. I'm the CEO of Synergy Dermatology and also an associate clinical professor at the University of California, San Francisco Department of Dermatology. Today, I'm excited to be sharing some new data that was presented at our recent American Academy of Dermatology annual meeting regarding spesolimab. Spesolimab is a newer biologic that we have that's FDA approved for the treatment of generalized pustular psoriasis. The mechanism is that it is an IL-36 inhibitor. We know that IL-36 is critical in the pathogenesis of GPP. It's what makes GPP different from plaque psoriasis and why our treatments for plaque psoriasis aren't always as successful in our patients with generalized pustular disease. So it's really exciting that we now have this new, very specific treatment options for our patients living with GPP. Initially, we had seen data in the EFFISAYIL 1 and EFFISAYIL 2 trials that showed us that spesolimab or Spavigo, which is the brand name, has been very effective in treating flares of GPP using IV dosing, IV loading dose. When a patient has a flare, the initial FSCL 1 data showed us that many patients were able to get complete clearance of their pustulation in as little as 7 days after that first IV infusion. FSCL 2 kind of looked at more long-term data where patients were then transitioned to subcutaneous dosing of spesolimab over time, and also found that the long-term maintenance dosing was able to decrease the flare-ups of GPP also in the long term. At AAD this year, we heard data from the FAAD ON or ON data, which is the open label long-term extension trial using spesolimab. These patients were treated with subcutaneous dosing of spesolimab up to 3 years is what we saw with this current data cut. And what we found is that in most patients, 75% of patients had 0 flare-ups over 3 years during this study if they were to continue on open label spesolimab. So that's really exciting for our patients living with GPP. We know that this is a serious condition, oftentimes has a high morbidity and mortality. Patients can end up in the hospital. It's also very debilitating from a mental health perspective because patients can't predict when their flare-ups are going to happen. So to be flare-free for 3 years on treatment has been really incredible for these patients. During the study, if patients did have a flare-up of their disease, they were allowed to get an IV loading dose, again, to get their disease into shape. And what they found is that 50% of patients who needed to get that IV loading dose, they were able to, again, get complete clearance of their pustulation in as little as 1 week. So even for patients that are well-maintained, who need to get that IV loading dose for a flare-up, they can still achieve those quick results that were seen in the initial FSCL 1 studies. As far as safety over these 3 years, there was actually no new safety data that we didn't see during the initial trials. There were some cases of injection site reactions that were seen in some patients, and there were some cases of UTIs that were also seen in some patients. And those were actually also seen initially during the FSCL 1 and FSCL 2 data. Luckily, there was a few cases of DRESS or drug-related drug reactions that were seen in the FSCL 1 data. In the long-term study, we actually didn't see a signal for DRESS. So that's also very exciting for patients that are living with this disease, knowing that the long-term safety of this drug is also good for the most part for most patients who are taking this medication. Spesolimab is available in 2 different forms. It's available as an IV loading dose of 900 milligrams that's used for flare management. So if a patient is having an acute flare of GPP, they should get that 900 milligram IV loading dose. So most often that's going to be given in an infusion center for your patients. Then there is subcutaneous administration for spesolimab, and this comes as 300 milligrams auto-injector pens. These are for patients who are currently not in a flare. If you're starting someone on Spavigo for more maintenance of GPP, you can start them on this dosing. Or if a patient has cleared after the IV loading dose and you want to transition them to maintenance, you can also use the subcutaneous dosing. The subcutaneous dosing, currently the FDA approved dose is a 600 milligram loading dose followed by 300 milligrams every 4 weeks for maintenance dosing. Now, in the FAAD on study, they did look at different dosing mechanisms, which were, or dosing intervals, I should say, which were 4 weeks, 8 weeks, or every 12 weeks to see if patients could kind of spread out the dosing. So there is some data available for the different dosing mechanisms, but here in the US, again, the FDA approved dose is every 4 weeks for maintenance dosing for spesolimab. Again, the data shows that the subcutaneous dosing in the long term can decrease the number of flare-ups that patients are experiencing. And then the IV loading dose is a great option to get quick clearance in your patients who are having an acute flare of the disease.